For everybody that is joining us, thank you today for joining us to this amazing event from the National Hispanic Medical Association, where we will find voices from the community, by the community, and the entire idea is to create conversations. We have been divided, we have had issues, and we have had so many things happening around us that it's so important right now to recreate some connection. The NHMA, the National Hispanic Medical Association, is the largest Hispano medical association in the U.S., representing a couple of thousands of us that we are out there making a difference for our community. Most importantly, we are here to serve anybody that wants to make a difference for our community. You don't need to speak Spanish. You don't need to be anything. You need to have that spark of making a difference for our community, and that's it. That's kind of the requirement. We will be joining today amazing doctors that have been fighting the good fight of bringing equality, equity, and most importantly, the tools for a better future for our community. You can join us at nhmamd.org on the website, and we are there for you. We have different chapters from the International Medical Graduate chapter. We have the Young Physician Council, and of course, we have a lot of interesting things that we're trying to do, especially right now, knowing that we do have a lot of things to do, especially right now around COVID-19. If it's okay with everybody, and knowing that it's 12:06 and we are ready to rumble. And I don't see myself, but I will try to see myself anyway. And I see myself over there. Today we're going to be joined by my regional amazing doctor Margarita Loesa. She is the chief medical officer for family medicine, actually for the Venice Family Clinic, and she's a family physician. She has seen a lot of the transformation in our community here in the SoCal area. And how rude of mine. I am Dr. Ilan Shapiro, Medical Director for Health, Education, and Wellness, and I have been part of NHMA for almost a little bit more of a decade. We're going to be joining three amazing doctors that have been fighting the good fight, as I told you a couple of minutes back. One of them is Dr. Jose Alberto Arevalo. He's the chief medical officer right now for Sutter Independent Physicians, but that doesn't tell you the entire story. He has been out there fighting for good policies, making sure that we're counted, and most importantly, that we're represented. A really close friend of mine and someone that I see as a mentor, Dr. Hector Flores, is the medical director for the Family Care Specialist Medical Group at White Memorial. He is someone that has opened the door for equity, equality, making sure that we get healthcare access, and he has been out there creating those little pathways that start small, and he makes sure that they know anybody by name, and the same as that whenever I get a call from him, I know that I need to answer in the next 10 seconds because it's always a pleasure to hear his voice and his knowledge. And last but not least, we have Javier Sanchez. Dr. Sanchez is the Associate Professor of Family Medicine at the University of California, Riverside School of Medicine. And God put him on my path. He is an amazing fighter. I met him by invitation right now to fight against COVID-19 disinformation, especially for our community. We saw that a lot of people, and he will probably share, and I hope that he shares, he had a lot of, we saw a lot of misinformation for our community. And most importantly, sadly, we saw it that it was not in Spanish. The resources that we had, and it was catered for other stuff. I do invite you, each of you, to send us messages through the chat box. We are here to answer any question that you may have, and we will be checking that part. And feel free to put anything out there, because we are here for you. We want to make it interactive, fun, and most importantly, effective for all of you. This is actually being transmitted live in Facebook. Then you can share it afterwards. And I'm going to turn the mic because I spoke already too much. Remember, this is actually the NHMA campaign that we're doing right now, Vaccinate for All. Make sure that you start helping us with all that stuff. And I'm going to turn the mic right now to la doctora Margarita Loesa.
Thank you, Elon. So let's get started. Our first question is on the booster vaccine. So there's a lot of confusion. There's a third dose out there. People don't know, much about it. And so I wanted to see if maybe Dr. Arevalo or Dr. Flores could answer the first question.
I'll be happy to start. So yeah, on the booster right now, the one that is approved for application is the Pfizer vaccine. And as most of you may know, it's recommended for people who had the initial series at least 6 months ago and are now ready to get that booster. Something that comes up that's a related topic, obviously, is when Moderna and J&J will be approved. Actually, this week will be the next step in sort of the process of approving their vaccines for the booster shot. The last thing I would comment on is that there's also this concept of mix and match, right? Where especially with J&J, these are the adenovirus technology vaccines, J&J, AstraZeneca used in Europe. And it looks like in Europe, by happenstance in Sweden and the UK, they ended up giving a second shot after they got J&J with an mRNA vaccine, either Pfizer or Moderna, and it seems to have an even stronger positive effect. So that also creates some confusion here in the States. As of now, Pfizer is only approved for Pfizer previously vaccinated individuals, and we suspect that Moderna will be approved for previously Moderna vaccinated individuals. J&J will be a different topic, and that'll come in the next few weeks. Dr. Arevalo, if you wanted to add in.
So yeah, I think that's great information. What I did want to note is that the approval for the booster currently is for 3 general groups. Those individuals who are 65 years of age or older, those between the ages of 50 and 64 who are high risk for severe COVID infections due to underlying medical conditions. And of course, there's a definition of those, and it's a standard really significant underlying medical conditions that fall under this category. And then also those adults between the ages of 18 to 64 whose jobs put them at high risk for COVID-19. And that does include, people in transportation, not just healthcare workers, people who are in high risk type of job environments. So I think that's very helpful to kind of know the real specifics of who it really is from the FDA standpoint, ready to get that vaccine. And it does, create a very large group that should absolutely be getting that booster vaccine.
Thank you. Thank you so much, Dr. Arevalo. And right now, I would love to actually direct this question to Dr. Sanchez. Is vaccine hesitancy the main obstacle in getting Hispano and Latinx Americans vaccinated, or is there any other story that it's happening out there that it's actually we talked about barriers, social determinants of health. What's happening now?
Thank you so much for inviting me, first and foremost, to this webinar. It's really a pleasure to be with all of you. The last 10 months or so, we've been working virtually to address the issue with hesitancy among the Latinx community, especially on the digital component of it. And so we are seeing a number of things there. So hesitancy has been an issue, and it started an issue at the beginning of it. But with all the information that we've been able to share, both on the digital media as well as one-to-one and with our community-based organizations, hesitancy has been less and less of an issue. And the other issue that has been a problem has been access, so equity. So at the beginning of this, the issue was who was getting the vaccine. And even though the rollout of the vaccine was sort of all over the place, our community was actually left behind. And our community wasn't able to get into the area so they could get the vaccine. And people like Dr. Flores and Dr. Arevalo have been working really hard on making sure that equity distribution of the vaccine is something that is paramount, especially here in California, and they've done a fantastic job. We've been able to reach community-based organizations and partner with them to make sure that they have the information available so they can reach out to their community to be able to get the vaccine. So that's been one thing. Lately, what we're seeing is primarily three groups. Number one is this group of what we call the second generation of Latinos who are mostly self-made business owners or people like that that are sort of have a leniency against anti-government, and they're mostly not wanting to get the vaccine, not because issue with disinformation, but rather they just don't like the mandate. So that's a small group. We have the other group of especially the Latino, the Spanish-speaking community, who is getting their information primarily from Facebook and WhatsApp, especially from areas outside the US where they're getting some significant misinformation, and they're still not being able to get the information that is correct. So making sure that they have the correct information from trusted individuals like their primary care doctors, their healthcare workers, and so on, that's very important. So that's what we're seeing right now. And then the last group that we have is a group that sort of just doesn't have access to medicine at all, access to care, and homelessness folks that we need to go out and reach out to them. So those are the three primary groups. And I'm glad to see that, especially here in California, these groups are becoming less and less from all the work that, again, that Dr. Flores and Dr. Arevalo have been doing to make sure that the state and community-based organizations are getting the information out there and are going to those communities to make sure that they get vaccinated.
Thank you so much, Dr. Sanchez. Dr. Arevalo, do you have any insights on that feeling of what can we hear all these problems and everything that we have done in the past months. Is there anything that we have learned that we need to repeat for other diseases, including COVID-19?
No, again, excellent question. Yes, I think we're learning more and more. We're trying to really understand, not just around the Latinx community, and as you know, we have been, and just briefly to kind of go back a little bit, I'm also the president and chairman of Latinx Physicians of California, and even though we're a small organization, we are one of two 501c3s that primarily in the state of California is interested in addressing and improving the health of the Latinx community exclusively. And so, we've tried to find ways to address the piece of how do you get to the individuals who are vaccine hesitant or vaccine adverse, and what are the the challenges there. Besides, some of the obvious, there really is when we take this population into consideration, we actually need to understand that there's also a very large population of people that may not really be truly vaccine hesitant, but who just have an inability to access the vaccine for a variety of reasons. And one of the commonest reasons is that so many of our population, particularly those who are underserved, have problems because of they just can't get, they have 2 jobs, sometimes even 3 jobs, believe it or not, and they just can't get away to get the vaccine. And unfortunately, many or large organizations who are well-meaning have set up these large mega vaccination sites, and they're not convenient to our population, not the right time, 10 to 4, and then, those sorts of issues. So many of us, including, LPOC, has worked to set up what we call pop-up clinics with different organizations in different regions of the state. And we've identified that what we need to do is set up the clinics at the time. So with all due respect, if Mohammed won't come to the mountain, we're going to bring the mountain to Mohammed. And setting up those clinics at more convenient locations close to the population that we're interested in, and then taking the opportunity to do things like, for example, Medicare is allowing the vaccine to be distributed to populations who really are more homebound, or for not necessarily in the traditional sense, but who have difficulty getting to their physicians' offices. And so being able to then provide that vaccine to those individuals in their home can be a way to really address some of this access issue. And then finally, of course, one of the most important pieces is getting the PCPs, or primary care providers, to really understand the opportunity. And we partner with the CMA and the California Medical Association to partner with individual medical societies, which are county specific, to be able to reach out to those physicians who are willing to provide. And again, we provide flu vaccines, we provide all sorts of other vaccinations. So really helping them recognize the importance of being able to access the vaccine supply, being able then to create the process for administration, and then be able to get paid for that administration. And so I think it's really critical that we continue to work under those circumstances, and then be able to identify what are the other challenges around vaccine hesitancy. And vaccine hesitancy really is education. It's the trusted messengers who, like Dr. Flores, like Dr. Sanchez, who, if we can get them in the kinds of media to be able to do mini messages, because it's really all we need is 10 seconds, 15 seconds to be able to have those trusted messengers in Espanol be able to identify some of the challenges around vaccine. For example, one of the commonest fears is that the vaccine causes infertility and causes pregnancy complications. And we know that that's not true. In fact, the opposite is true. Pregnant women should be vaccinated, because we're seeing a significant problem with unvaccinated pregnant women getting COVID and having significant complications and unfortunately dying, and as well as the baby. So having the opportunity to have those trusted messengers give these messages in a variety of settings in Espanol and in English, and being able to address some of those misconceptions and misinformation that unfortunately is prevalent all around the community, are the things that we really need to continue to do. And again, we continue to have data, and the current data in California is that we are still not at the rate that we really want to be, where we have been vaccinating very high number of people, but we're not reaching all of the, especially underserved Latinx community. So thank you.
And Dr. Shapiro, and I just wanted to add and congratulate Dr. Arevalo for the work that LPOC has done working with the State Department of Public Health, Dr. Tomas Aragon, has been very supportive in looking at the lessons learned from this pandemic. We all know that COVID exposed many deficiencies in the system, not only starting with Latinx communities and other underserved communities, but also the fact that we historically have underfunded public health and we have failed to integrate it into the medical delivery models. And the work that Dr. Arevalo and his colleagues have been doing is to advocate for, a different way of delivering public health services and bringing together large organizations that are delivering medical services and the accountability that they have to be partners with public health. The second thing is, the granular distribution of the vaccine, not only mobile units and other creative ways to reach our hard to reach populations, but empowering the primary care physicians, particularly pediatricians and family physicians, to be ready and to actually get grant dollars from the state to cover the cost of implementing a vaccine strategy in our offices, which will be huge, not only for the boosters, for all the eligible groups that Dr. Arevalo mentioned, but it'll be huge once younger children, hopefully infants, will be approved for the vaccination themselves. That'll be those frontline officers along with mobile units and others that will be able to get us over the hump of herd immunity. So I want to thank him for all the work he's done.
Thank you for all your support as well, Hector.
That actually opens a beautiful conversation on, and I saw a couple of questions on the back end, about Orange County, there's a lot of fear, misinformation, barriers. And this question is actually for Dr. Sanchez. Dr. Sanchez, you have seen a lot of the things that we have done, and a lot of people ask us, it's crazy days, I'm tired, I'm burned out. It has been a horrible week. Nobody wants to get vaccinated. Plus, it's not that we call diabetes, hypertension, vaccines for kids to go away. No, we still need to manage that. What can we do as regular doctors on our day-to-day to actually fight that fear of misinformation, disinformation, and all that side effects that we're having in our community because of information?
Yeah, thank you for that question. It is sometimes it can be incredibly overwhelming, the misinformation and disinformation that's out there. I mean, just look at the data on Facebook. There's only actually 12 sites that represent about 90% of the misinformation in our community, in the Latinx community. Most of this information is actually coming either from out of the States or from Florida, for folks that are out there spreading misinformation and disinformation. But Dr. Arevalo made a great point, is that we've been able to identify the trusted messengers. And who are those trusted messengers? Well, they're the family physicians, the pediatricians, the nurse practitioners, the healthcare heroes. And I'm proud to say that in the last 10 months, we were able to develop this group of Vacunate Ya, of trusted Latinx physicians, not just here in California, but throughout the states, that been able to partner with CBOs to make sure that they fight the misinformation and disinformation that's out there, both in Spanish and English. Just recently, you participated in our with one of our partners here in MLK to provide the correct information to 50 different pastors and their and the folks there follow them to provide them the correct information. And we're doing that over and over and over again. And by partnering with the CBOs, somebody mentioned about Orange County. So we find counties here in California, like Orange County, like my county, San Bernardino County, that we have a lot of misinformation and disinformation. And unfortunately, it's being spread by our own sort of politicians sometimes. And so we have to go in there and partner with the community centers, with the community health centers, with the CBOs that are there, and make ourselves available to make sure that when they do the vaccine drives, that we're available there to provide all the correct information. And that's what we need to do. We've been able to also develop Facebook Live events We have a website that provides all the information. We've been able to partner with Los Amigos on Clubhouse, which is another medium that a lot of our Latinx young people are using to get information, to be able to provide them the correct information. So it's an uphill battle, and I wish I could tell you that we're winning, but we're getting close. I mean, when we started this, less than 30% of our Latinx population here in California was being vaccinated. As of last week, almost 70% of our Latinx community has had at least one shot, which is fantastic. And that goes to all the work that all of you have been doing the last 10 months.
Okay, thank you, Dr. Sanchez. Thanks for all your work in Vacunate Ya. So last winter was pretty brutal, and then we had the Delta variant. What do you all see for, Thanksgiving, Christmas, the holidays, and, the booster shots? What do you advise the public about this winter and the flu vaccine?
Well, I certainly can start. I think the main thing is to get vaccinated, of course, and get their boosters. We know that in the cooler weather, and we're starting to see as the weather changes in the East Coast, Vermont, New Hampshire, Iowa, in the Midwest, have already experienced some increases, upticks in the number of cases and hospitalizations. If we look at the Southern Hemisphere, which is basically finishing their winter season, there was a study out of Australia that showed an increase in the number of COVID cases, particularly Delta. So we do need to be cautious. The fact that although we're seeing the numbers dip across the country, and certainly here in California, not only the cases detected, but also hospitalizations, that we can't sit on our laurels. I think we need to continue to promote masks, sanitation, social distancing. I think our public health departments have done a great job of doing that education, but we can't let our guard down. I think that's going to be really key.
Yeah, I think that's
totally
excellent point by Dr. Flores. The one thing that I just want to point out, we now have significant data, especially from North Carolina, because North Carolina was one of the states that actually has implemented masks in schools. And we're seeing that the data that's coming out of Duke, who's following doing the gathering of the data, is showing that by wearing the mask alone, it's decreasing the infection rate in the schools significantly. And then you put that on top the vaccine, getting vaccinated. So we need to make sure that we continue to provide that information to our population, and make sure that just because they want to get back to whatever normal that is, that we need to continue to encourage them to get vaccinated first and foremost, to get their boosters, and to wear masks and to practice social distancing as best as they can.
Yeah, I totally agree. And I think great points, both by Dr. Sanchez and Dr. Flores. Well, and one of the things that we recognize is that, clearly the need for vaccination does decrease your likelihood of getting infected, but it doesn't go down to zero. So these vaccines are not intended to keep you necessarily from getting infected. They really are intended to keep you from getting hospitalized, from getting significantly sick, getting hospitalized and dying. And that's really the same thing for influenza. Things that we forget is that influenza has been responsible for 40 to 60,000 deaths annually. And it is a fairly significant deadly disease as well. And the influenza shot was not made necessarily to keep you from getting a runny nose and a sore throat. It's really intended to keep you from getting significantly sick, from getting hospitalized, from getting to go to the ICU, and from dying. So both of those are really, really critical viral infectious diseases that now have at least the ability to be affected from those negative outcomes. And so I think one of the things we hear with the influenza that we've heard for many years is, well, I don't want to, I'm not going to take the influenza shot because, I took the shot about 4 years ago and then I got sick and had a cough and a cold and felt significantly ill for a while. Well, unfortunately, again, what we're saying is we want you to take the influenza shot, especially if you're high risk, to prevent you from having those significant adverse events. And yes, you may get rhinovirus or coronavirus, and that's not what the influenza shot is intended to prevent. It can't prevent those, and you may get a cold, but hopefully you won't get influenza, and more importantly, you won't get the complications. I think the importance is to educate individuals about, the importance of preventing those complications, that the vaccines will hopefully prevent you from getting infected. But one of the things that we saw this week is that, unfortunately, even if you are vaccinated, and I'm referring to Mr. Colin Powell, who unfortunately was very high risk because he had multiple myeloma, and that's a very significant immunologically related disorder. He was vaccinated, but the other conditions prevented and this is a kind of immune-related condition, like some cancers are, and prevented, a complete protection. And so the intent is to vaccinate as many people, including children, once the vaccine is available for children, so we can prevent the spread of this infection. We can lower the likelihood of the spread of this infection, and particularly with vulnerable patients and who have all these significant comorbidities that, even though they may be vaccinated, they are still, unfortunately, at risk. And so it's really critically important for us to push the vaccine for as many people as possible. The other issue is that we are now dealing with one of the most aggressive viruses that we've ever seen in the history of medicine. And that's because there's a variant, the Delta variant. Well, we now know that there are other variants that are happening at very high rates. And, the Lambda and the Mu clearly are the ones that we've identified that are recently affecting our borders in the United States. And the issue is that the more that there is a spread of this virus, especially in an individual, and the more that individual is not protected by vaccine and has a high viral load, the more likely that the reproduction of that virus can result in even more significant mutations. So that's really critically important, and it's a real driver for us, not just to kind of immunize as many people as possible, but to get it done as quickly as possible so that we minimize the likelihood of other variants and like the Delta variant that is so communicable and is also slightly more lethal than the Alpha variant that first hit our shores back in 2020. So I definitely agree that we need to continue to practice the other measures besides vaccination, and the mask wearing, the social distancing are critically important.
Thank you so much for that, Dr. Arbelos. Right now, we're getting to a point that we have heard, what's the reality, what's happening right now. We're hearing a lot and from our three panelists, the importance of communication, the importance of being present. And one of the things that I have seen, and this is a question for our three panelists, is in the past, as a physician, they train you to be there, make sure that you do the correct diagnosis, you're part of the community, you're doing things, but they never. And of course, we all had public health 101 and let's go out with the community. But the role with doctors usually was on the second row, was kind of the experts. But for one reason or another, was not the same thing happened with scientists. We were not on the front line. We were not there communicating with the way that the community wanted to be reached. We had our own feeling of what they wanted to hear, but the reality is when we translate that from medical-ish to actionable things to the community, everything changes. Right now, we are getting close to December, and Dr. Lessa actually mentioned that the winter is coming. Influenza is here. I would love to know what's your feeling of how can we better prepare the future generation, the current generations of physicians to communicate. That's one. And the second one is, what do we do with the influenza? Because influenza it's here, it's active, and a lot of people go like, well, do I need to choose between COVID-19? Do I need to choose between influenza, or can I get both? Then if it's okay, we can start with Dr. Flores.
Sure. Well, you touched on a lot of really important points, Ilan. Clearly, protecting against both is really important for the reasons Dr. Arevalo mentioned, also that there's other viruses that we don't have vaccines against, so we want to minimize the risk of the influenza and COVID. And yeah, just for the public to know that both vaccines can be given concurrently, safely. It's already been established. What they do recommend is different sites in case there's a reaction to either one, COVID or the flu vaccine. Some physicians actually give it in different arms, but you don't need to. You can give it in the same arm as long as you have at least an inch separating the sites. The second thing that you mentioned, which is really important, is that really the work Dr. Sanchez has been doing is getting out in the community and creating an example of where medical education needs to change. And as I see that now, he has a professor position. He's going to be influencing a lot of the emerging young physicians in a really positive way. And I would hand it off to him to kind of share what he's doing, because I really see the work that they have been doing nationally has major impact, and really being at the school can make a big change. So Javier, I congratulate you on your work.
Well, thank you, Dr. Flores. It's very kind of you. Yeah, I've been very fortunate that I've had the opportunity to be part of an educational community now for almost 20 years. First with in Chicago at Cook County there, and then at USC, and then now with UC Riverside, and even with my sort of employer, Kaiser Permanente, in our medical school. And one thing that I've always shied away until recently was social media. I've never really been one that likes to share too many things on social media, but having met all these young physicians in the last 10 months who recognize the importance of social media, especially with our Latinx community, and how much they spend on social media and how important it is to make sure we get the correct information, we were able to put together a fabulous team, and social media, and look at what was happening in social media and how we can influence people through that. We've been able to have almost 1 billion impressions with all the social media posts that we've been doing in the last year. We've been able to make sure that we partner with over 150 community-based organizations, and making sure that we provide the correct information about COVID. But we're thinking ahead now, what other information we can do, public health issues, influenza that's going on right now, diabetes, all these things, how we can utilize social media to be able to do that. So in the last 2 months, we've been able to partner with a huge public health organization called Public Good Projects. I'm sorry about that. Public Goods Project, that has the ability and the funding to be able to take our work on the digital spectrum and be able to provide us the funding that's necessary to even expand it even more. And we're recruiting more and more physicians, frontline nurses, frontline healthcare workers who are interested in providing this information and get trained. We recently have a contract with the California Department of Public Health to educate, especially the rural physicians, on the importance of the vaccine, on how to address vaccine hesitancy, which has been brought up in their community, and we continue to do that work. So, and then we've been able to partner with Dr. Vivianca Martinez over in North Carolina, that she's been doing fabulous work out there to encourage not just vaccination, but encourage equity work in the community out there. And we're taking a lot of her lessons that she's learned and try to implement them in the work that we've been doing nationally. So it's engaging to know how fantastic it is to get all the young physicians that are interested in doing social media and how to utilize their resources to be able to get the work out. But again, we have a lot more work to do, and we've been able to get some funding. We're working with University of California, Riverside now to write a grant to continue to do the work. Public health project is going to help us develop some more funding. We've been able to reach the CDC. That we're working on trying to get a grant of $5 million to continue our work. So it's just a matter of time to continue to do all this digital work that we've been doing, and encouraging all our young physicians, young nurses who are interested in doing this work to provide them a platform to be able to do it.
Thank you, Dr. Loaiza, sorry.
Okay, thanks, Dr. Sanchez. You know, I get asked this question all the time, so I'm going to ask you all, when will this pandemic end?
What we hear from CDC, Dr. Fauci actually, has been pretty, I think reassuring to the nation, is if we continue the current trends, including vaccination and boosters and continuing to practice safety, there is a lot of hope for sometime around next spring, April, May, that we will actually have it under control with national herd immunity, not only from vaccination, but also people who got the infection, and even be able to deal with the variants that are coming down the pike. So I think there's a lot of cause for optimism, but we got to stay the course on what we've been doing so far.
Yeah, regrettably, I do agree with Dr. Fauci, but unfortunately, we have a fairly significant number of individuals who will not get the vaccine, and unfortunately, they'll probably get the natural immunity because they'll get infected, and hopefully that will allow for a barrier for this very contagious, very highly contagious Delta variant. So that I think, it's pretty clear, at least in my mind, that this COVID-19 and its various, progeny, which is the variants, is going to be here to stay for quite a while in our community. But I do agree that if we reach a level of, and by the way, I think we're learning that the level of herd immunity, which at first was somewhere between 70 and 80%, based on the Delta variant's infectivity rate, it's more closer to 90%. And so it's going to be challenging to get to that level of both passive immunity, which is the vaccine, and the natural immunity that will occur when people get infected, unfortunately. But I think COVID is going to be here to stay with us for quite a while. It's no longer just a pandemic, it's now an endemic to our communities and around the world. And I think that's where we need to recognize that there are real challenges around the world, in Africa and other countries, where because of the inability of the more developed world to be able to reach and share vaccines with that population, that we're not going to eradicate it anytime soon from the face of the earth, if ever. And so that's one of the serious concerns. We know that we can actually pinpoint where we think it started in Wuhan in China, and then it's spread so rapidly across the world that if there's variants that are even more aggressive that happen in the third world countries or other countries, we could see a similar scenario happening. And I hate to bring that up, but I guess I'm a little bit more pessimistic than some of the. I'm not an expert, by the way. I'm a family doc. I'm a country family doc, but because it's hit my community and my family so hard, I've felt that we really need to educate ourselves, and so I do share some concerns about us eradicating this infection from the world and from our shores.
Yeah, and Dr. Arevalo brings up some great points, and I think it's important for us to continue to let everybody know that we need to continue with the mitigating factors, the face covering, the hand washing, the vaccines as often getting the vaccine as quickly as you can. But also, I like to be a little bit more optimistic in general and look here in California. We have some great successes here in California. Sonoma County, up in just north of San Francisco, they've achieved 90% immunity now with vaccines and natural infection. Just in LA County alone, I think we're almost close to 70%. But then, we have counties like my county, San Bernardino County, that we're still right around 55%. But we need to continue to push, continue to not let our guard down. And we're seeing states also through here in the U.S., different states that are achieving 80, 90% immunity. So I don't want to let people think that this is going to be forever. I think it's something that it has changed the way we do. We need to make sure that we continue with the mitigating factors. Again, wearing your mask, washing your hands, practice social distancing as best you can, and getting vaccinated. But we're hoping that we can get back to whatever that normal is sometimes sooner rather than later. But I think we're almost there. This weekend, I was able to go to LA for the whole weekend, and I was glad to show my vaccine card. I didn't have any problems there. I felt so comfortable because we went to the theater, we went to a soccer stadium, and everywhere they asked us for our vaccine card, and felt so comfortable. The air sort of let out, my tension sort of let out, because I was able to be around everyone that was vaccinated there. So I didn't have that fear that I used to have in the past. And that really relieves a lot of anxiety. And if we continue to do that, I think we're going to get to a more normal world sooner rather than later.
And I would add to those great comments by Dr. Sanchez and Dr. Arevalo that first, I want to thank the National Hispanic Medical Association for hosting this event. And it really reflects the strategy that I think we're learning as we go, but we're learning what can be effective to eradicate this or at least control it. And that is that we need the Air Force, what Dr. Sanchez and Dr. Arevalo are doing. They're on the air providing cover and looking at the big picture, while those of us on the ground, and I would include your organization, Dr. Shapiro, Altamed, Dr. Loesa's, Venice Family, community-based organizations like ours that are also part of that, identifying the granular strategy that actually reaches every patient. And this is where technology will be our friend. We're working with a company called Cogitativo that actually does geomapping and can pinpoint where the patients or the people are who have not been immunized yet. And so now through a HRSA grant, we're deploying promotores, community health workers, who are trusted sources, as both Dr. Sanchez and Dr. Arevalo mentioned earlier. They're a trusted source of information. They're part of the community. And we're getting the word out now to those homes that are isolated, including also a homeless project, so that we can reach those who are encountering housing challenges. All of that is solutions that I think we need to codify, because we're learning as we go, but there's a lot of creativity that we can put into action to bring this under control, but also deal with any pandemic in the future.
We and probably everybody that's here, we have been part of multiple panels, and we have heard this billions of times. But I feel that there's a different tone to the words that we have right now. We have the community, we have experts, we have technology, we have everything. And one of the things that and I'm blessed that I have been part of. We have been together fighting with Dr. Flores, Dr. Loesa, and Dr. Sanchez, and Dr. Arevalo. I only on the Latino physician policy part I have been fighting with you, but with you, not against you. And the important thing that we have right now is that we need to unite. We need to make sure that we are preparing, and we will have 3 levels of people and physicians that want to get involved. Those ones that just tell me what to do, I will just put the pamphlets in my office, and that's okay. That's good. we're participating. There will be those that want to come to this type of conversations and amplify and switch and continue and retweet and share the link. And there will be people that want to create more content, create content, train other people, create our other physicians, our other brothers and sister nurses, and amplify to promotoras that I do believe that are key for finishing or protecting more efficiently our communities. And you have all these choices. You have part of the important things of the National Hispanic Medical Association is to unite different voices from our community to amplify health. And I think that we did it today. We got to the point of sharing, vacunate ya, this is our shot, the efforts that Dr. Flores, and it's very important to know that, the things that he's doing in LACMA and making sure that we get resources and protection for our community, going with Dr. Arevalo, that he's going out there, making sure that the policies that we're creating for education and workforce development and everything, and the voice of our physicians be exposed. And of course, Dr. Sanchez doing the good fight over there. And Dr. Loaiza, any last words before we finish, because it's already 12:54.
Well, I want to thank everyone for joining, and actually listening to you all has given me a lot more hope than I had prior to starting the webinar. I just did clinic this morning where I was like arguing with people on why they should be immunized. So I hope that I'm glad that we're all alive and well, and we're all here for the same reason. We want people to wear masks, social distance, wash their hands, get their flu shot, get their booster or their first COVID shot. And we want, we have a really group of great mentors that I've worked with in many capacities here today. And that, and we really want to reach out to the Latino physicians and Latino patients and let them know that we're here for them. And we want them to get immunized. So I want to thank everyone for today for making me feel better.
Last but not least, thank you so much for the amazing team that we have behind the logistics. Ariel and her amazing team. They go out there. This is the first time in the National Hispanic Medical Association that there's an entire team devoted for you and by you. Then please do join us, create a conversation, because we ahora sí, no somos muchos, pero somos muchísimos if we're united. And that's the idea, that we need to be all together and create this. We'll hopefully we'll see you in November 18. And there's a couple of other options and things that we're going to be creating as part of the local chapter. Then if you have doubts, you know where to reach us. And I'm going to be putting there somewhere on the rainbow in the chat my information. Then please feel free to join us, search us, and create conversations. And familia, muchas gracias. May we have a December that we hug people, that we love people, and we go back to the way that we were before. Then muchas gracias por estar aquí.